Alright, continuing with the concepts and components of fitness, we're now going to look at the skeletal system. Firstly, the skeleton. In your manual, the electronic version or the hard copy, you'll have this anterior or frontal view of the skeleton, and then the posterior or rear view with all the bones, major bones of the body labelled for you to have a look at. You need to learn those. Quite a lot to learn there, really. So the skeleton has quite a lot of functions, and we're just going to have a little look at some of them now. The first one is the protection of vital organs. So if you didn't have a skeleton, then you'd just be able to put your hand straight in and mess around with your organs, which wouldn't be good. Second one is levers for movement. So your skeleton is the base for a lot of muscle movements. The only reason muscles are there is to bring about skeletal movement. Thirdly, they provide a bony framework for support, so basically so we can stand up. The production of red blood cells is another function of the skeleton, and also the provision of surfaces for muscle attachments, as we said earlier, and then to store minerals as well. If you look at that, you'll see PMS, which are two things you can remember if you want a little bit of help in remembering those things. We're now going to look at something called the axial and the appendicular skeleton. Two parts of the skeleton. The first one, the appendicular bit, which is the upper limbs, two clavicles, two scapulae, lower limbs and the pelvis. And the axial skeleton, which is the bit in the middle really, it's just the head, the vertebrae, the sternum and the ribs. We're going to look at some classifications of bones. So, different classifications. Firstly, a long bone, which is longer than it is short. And that's a couple of examples there, the humerus and the tibia. We have short bones, which are carpals and tarsals in the hands and feet. We have flat bones, such as the ribs and the sternum in the chest, and irregular bones, some of them found in the face, some in the vertebra, and also sesamoid bones. And the patella is a sesamoid bone, with patella being the kneecap. We're going to look at some things now that bring about formation or ossification of bone. So ossification is brought about by something called osteoblasts. These are bone building cells, and if you remember the B for building out of osteoblasts, that will help you. And the other cells that affect bone growth are osteoclasts. These break down and remove old bone. So you've got the osteoblasts adding bone and the osteoclasts removing it. We have some factors that affect bone formation. One is nutrition, another exposure to sunlight. We have hormonal secretions and also physical exercise. We're going to look at something called osteoporosis now, which is quite common in some people, particularly postmenopausal women who lack estrogen in their bodies after going through the menopause. So osteoporosis just means really porous bone. So imagine a bone that's a bit like a sponge. Osteo meaning bone and osis meaning degeneration, so bone degeneration. It's also known as brittle bone disease. Osteoporosis itself can be caused by several things. One is an insufficient calcium intake, insufficient vitamin D, so lack of sunlight can cause it, poor nutrition and diet, and amenorrhea, which is a loss of periods in women. Menopause is also something that can bring it, as we just said. Osteoporosis can be caused by women when they're postmenopausal. Weight-bearing exercise helps to increase or stimulate osteoblast activity, therefore increasing bone density. So bear that in mind when you're writing programs for particular people.